Welcome to Adapt NCLEX. After reviewing reports from previous NCLEX test takers, these 10 ethics scenarios keep appearing. Let me show you how to answer them every time when you see it in practice test or during your NCLEX. 10 questions on ethics and legality. We're going to master them. I'm going to show you the key aspect of it. Are you ready? Let's dive in. First question is a next generation kind of question. So this is the case. 16-year-old client is admitted to the emergency department after an assault, right? And confined to the nurse. My stepfather did this, but please don't tell anybody. I will get into trouble. On assessment, client has visible bruises on the upper arm and back. Which nursing action is most appropriate? The way to read the next generation question is to go back, underline the buzzword, and form your sentence. I have a 16-year-old. He's in the emergency room. Something is wrong. We suspect a patient was assaulted. And this is what the patient told the nurse. Don't tell anybody because I'm going to get into trouble. My stepfather did this to me. The nurse examined the patient, saw some bruises. What action should the nurse take? Now look at each answer choice. Go for the buzzword. Assure the client that the information will stay confidential. Report to the appropriate authorities. Wait until the client feels ready to disclose to the others. Discuss the report with the stepfather first. I'll give you a few seconds. Think about the question and the answer choice, and then put your answer down in the comment section. Now let's break it down. Look at it. We suspect an abuse. Each questions we're going to talk about, I'm going to give you a concept and I want you to write it down. That's all you need for ethics and legality and legal, right? What is the concept here? The nurse suspect an abuse. Should the nurse assure the client that this will stay with her and the patient? Or should the nurse report it to authority? Or wait until the client feels ready to disclose and discuss the report with the stepfather? What is the concept? What did you put down? I can tell you, number 2 is the right answer. Why? Because the nurse is a mandatory reporter. Let's look at each answer choice and break it down. One, each is wrong. One, we cannot let this be between you and the patient because you are a mandatory reporter. If this continue to go on, patient get into trouble and die, or something happened to the patient. You got to report, you get into trouble. 3 is the same thing. 1 and 2, 3 are saying the same thing. He said, wait until I feel comfortable. Well, it's the same thing, keeping it confidential. When you feel comfortable, you come to me and say, I'm ready to report. Wrong answer. Discuss the report with the stepfather. Stepfather is going to get into trouble. He's going to get mad at you, and the patient is going to get in trouble. So what do you think? This is the key. Write it down. Mandatory reporter is the nurse. You have no choice. If you see an abuse, open your mouth and let it go. This is the first question. All of them as a concept. They get harder as we go. So stick around and see the hard questions as we go. I try to take you up and down so that you can see this ethical principle. This is next generation. So this is part 2 of that question. Now, select the ethical legal principle that justify this action. We know the action the nurse is supposed to take, report it, because she is a mandatory reporter. This video is like a lecture. I'll give you the key fact associated with that. Mandatory reporter. If I am a mandatory reporter, am I playing the role as what? Fidelity, or am I showing evidence of fidelity or nonmaleficence? These are ethical principles. This is what the NCLEX text most. Autonomy or beneficence? Which answer choice will you pick? Put down in the comments and let me see. I know you got it because we know what we're doing. We're trying to prevent harm to the patient. Look at each of the answer choices and see if it means the same. What is fidelity? It's keeping your promise. I'm not causing any harm to the patient. Nonmaleficence, I will leave it that one. Autonomy, basically, you're just respecting what the patient has to say. Now, beneficence and nonmaleficence, you have to know the key difference. One is to prevent harm. The other one is to do good. Doing good is not the same as preventing harm to the patient. That is the key. The way to remember preventing harm is the non-maleficence. So number 2 is your right answer. While beneficence is doing good for the patient. We know we're trying to do good, but that's not the purpose. The purpose is to prevent further injury to the patient. Therefore, your concept is to prevent harm to the patient. Write it down. Nonmaleficence is prevent harm. This is part 3 of that question. Select the expected outcomes of the next action. You can predict if I'm preventing harm to the patient, what is going to happen? The client receives protection and safety resources. Stepfather is notified of the nurse report. The client refuses further care, or the nurse avoids legal involvement. Think about it. There's a trap answer choice there. The reason why ethics and legality is very difficult. The answers are very deceiving. They all sound good. You think you pick your right answer, but you got to follow the principle associated with ethics and legal. And what is that? The nurse is preventing harm to the patient. In the process, she's not avoiding legal involvement, even though she's doing it unintentionally because she needs to report it. That is not the purpose. So don't pick number 4. That's the one I know most people will pick it. Because she's a mandatory reporter, doing it for the patient. And therefore, number 1 is the right answer. This is the end of the case study. Let's get to it. Preventing harm. This is number 4. This is also a quick scenario, and I want you to write the concept down. It's the most common one that usually comes out. Which action by the nurse is most appropriate? It's a legal and ethical problem. The nurse is caring for a client with what? Stage 4 colon cancer who has what? Refused chemotherapy and signed a do not resuscitate order. What would you do? Respect the client's decision to refuse treatment. Communicate changes of the status at shift change. Encourage the client to reconsider chemotherapy option. Document the client wishes and the DNR status in the medical record. What do you think? Think about it. I'll give you a few seconds to think about it. Then I'll give you the concept. The concept is what? Autonomy is the key. Patient said what? What is the key word? Do not resuscitate. And the patient signed it. Therefore, the most important thing, are you going to respect the client refusal to, are you going to respect the client decision to refuse the treatment or communicate the changes of the status at shift or encourage the client to reconsider their therapy? Number 3 is absolutely wrong. Why? He said he does not want anything. Document the wishes and the DNR status in the medical record is not the most important. The things that are most important. Respect the client decision to refuse the treatment. Fine, I'm going to respect it, but it's not the most important. The most important is everybody who is going to take care of this patient should know that this patient is now DNR. Therefore, these has to be passed on to every nurse that come in contact with the patient and the provider. Therefore, all staff need to know code status. Very, very important. Number 5, which statement indicate a need for further teaching? You see the way I approach the question, I read it from the back. Now I know I'm talking about further teaching. That means they're doing something wrong. The nurse attend staff education about living wills and power of attorney. The big area of the NCLEX ethics issue. You got to know the difference. Which statement indicate the need for further teaching? 1, living will let somebody make a decision. Does he do that? Power of attorney works if client can't decide. 3, living will show care preference. Power of attorney can override living will. Living will and power of attorney honors client's wishes. This is a select or apply. Don't pick everything. Just select those that you know you're confident and then move on. Never over-select. Which one will you pick? There may be one answer there. There may be multiple answers. I don't know, but we're going to break it down. So I'll give you time to think about it, to put your answer down and let me know. But what do you think? Living will, power of attorney. There's a difference between them. A living will, let someone make a decision. No, I make my own decision. Therefore, this is wrong. Power of attorney works if the client is what? Cannot decide. That is the thing. I'm delegating my authority to somebody else. A living will shows care preference. This may trap some people, but it means this is what I want. The care preference I want is a living will. This is what I want. Power of attorney can override a living will. No, it should not do that. A living will of power of attorney on his client's wishes. Both of them does. And therefore, 1 and 4 are the wrong answer. The question says, need further teaching. 1 need further teaching, and 4 need further teaching. And this is what is the key. Living will does not appoint a person, right? Power of attorney cannot override a living will. They are separate entity, but they are all advanced directives. Number 6, what is your score? I want to know. 5 out of 5, put down in the comment and put hashtag 1 out of 5. I get 5 out of 5. What do you think? Number 6, which client cannot legally provide informed consent? I put in the select or apply so that I can teach you something. This is the way they ask the questions, right? Select or apply about informed consent. You have to master informed consent. Very typical question. The nurse is caring for several. They are psychiatric clients. I try to make it and other patient, right? Who need what? Consent for procedure. 1, a 35-year-old, he has schizophrenia, and he takes 3 antipsychotics. A 20-year-old has depression, and he has lost interest in the activity. 25-year-old has bipolar. He's experiencing pressure speech. The 30-year-old is anxiety. He takes some Valium. And the other patient is 16-year-old with autism, and he's married. And a 90-year-old who's happy to be there, he has CHF, and he's windowed. So he may have something going on. 3 weeks ago, who cannot consent? They're going to have surgery. They say, which client cannot legally consent? There is a concept. What do you think? Norman says, did you figure it out? Did you put your answer down? Let me break it down for you. Each answer choice, there is a concept. A psychiatric diagnosis should not prevent you from consenting. A psychiatric diagnosis should not prevent you from doing your own consent. A schizophrenia is not hallucinating, it's just on medication. I expect him to be on medication. He should be fine. Depression patient, he has lost interest, but there is no suicidal. A bipolar patient, he has processed speech. That's what I expect from them. Anxiety patient, what do you think? He just received value. Autism patient is married. When you are 16 years old and you married, you considered emancipated minor. It's fine. A 90-year-old, your age should not prevent you. And if your wife just recently died, should not prevent you. And you can see the only answer choice is somebody who received Valium. And what does that mean? If you suicidal, if you taking any narcotic or sedative, you can't consent for yourself. Otherwise, or if you are incompetent, otherwise, all these patients can do that. Patient is sedated. Number 7, what is the nurse's best action? The nurse is caring for a 68-year-old client who had end-stage renal disease who previously signed DNR. Do not resuscitate. That means if I'm dying, let me go. The client is now unresponsive and pulseless. That means dying, right? Unresponsive, pulseless. The client's adult son who recently arrived from out of state here, save my father, start CPR right now. What would you do? Patient said, I don't want anything to be done. I signed the consent. All of a sudden, I'm dying. My son came. He said, okay, do something. You see, I'll break it down. What would you do? You put the buzzword together. CPR. Do you want to do that right away? Explain the CPR cannot be started. You tell the son like that, it's going to be mad. Call the provider to clarify the patient's wishes before acting. Call the provider and make sure before you do something. Patient is dying. CPR need to go right now. Remove the DNR order until all family members agree. Well, nobody agreed. Nobody was there. It was the patient who signed it. What do you think? What do you think? How would you approach it if you see this question? Like I said, this is what the scenario commonly tested on the NCLEX. Number 4, it's not right. Right? Patient has his own autonomy. Therefore, I don't care about the family members. The provider is somewhere, but the order said do not resuscitate. So calling the provider to clarify, who are you going to clarify from? Patient sign it. So clarify with the patient. Begin CPR right now. They will send you to jail. Explain to the CPR, explain that CPR cannot be started because the patient does not want it. That's patient autonomy. Number 2 is the right answer. So whenever there's advanced directives, be careful when the patient is coding. And you see a question like that, stick with your gun. Now, I want you to master this ethic principle. Write this down, stop the video, put down your answer if you want. But I want you to know them because they are free questions. You want to pick that point. Don't let the NCLEX steal it from you. Honest is school. Pick it. Ethic principle. And then says attended staff education on ethic principle. Assuming this was you, put yourself in that situation. You went to a meeting. We talk about ethical principle. You're asked to pair the individual diagnosis with the definition. Which principle pairing indicate a need for further teaching? That means you did something wrong. Autonomy says doing good for the client. Beneficence, avoiding harm. Nonmaleficence, respecting the client's choice. Keep justice, keep promises, and maintaining trust. Fidelity, care should be fair, not based on personal preference. Now, think about the answer choice. I give you a few minutes and think about it. Which answer choice will you pick? Look down in the comment section and put down your answer. Let's see. But these are principles. I want you to master them. Right? So let's see. Autonomy, definition is respecting the patient. Do you see anything there? It goes here. Beneficence, what do we say? What do we say, beneficence? You are doing good for the patient, right? You're doing good, right? For the patient. And this one go here. Nonmaleficence is to prevent harm to the patient, not to respect the client decision. And justice means justice, liberty, justice, right? Everybody equal under the law. Therefore, care should be fair. And fidelity is maintaining your promise. I guess the nurse couldn't master this ethical principle. So all of them need further teaching. Why do I say it that way? So that I can give you the easy definition. I don't have to just say it, but in a question form, you can see that it does not match. And your eyes will talk to your brain and you will keep it every time you see it to say, oh, this is the best way to answer it. Therefore, I want you to take a picture of it, memorize it every day, and know them. 2 more questions, and we'll be done. All of them are wrong. These are all wrong ethical principle pairing. And next, attend an in-service education about informed consent. You see why I keep on going back to informed consent. I yield content, master them. Which statement by the nurse indicate a need for further teaching? What do you think? Informed consent. What are the specific information about informed consent? It is the provider's responsibility to explain the risks and the benefit of the procedure. Is that right? I can serve as a witness, you the nurse, to decline signature on the consent. What do you think? A client in pain should receive narcotic before signing the consent. Is that right? The client must be competent, voluntarily agree before signing. Informed consent. Few seconds to think about the answer and see if you can put your answer choice in the comment. I know you got it because you want to few seconds to think about the answer choice. Stop the video, put down your answer, try it, and then play the video and listen to me. What do you think? Informed consent means I have to inform you, and then you sign consent. Provider responsibility, you are the one doing the procedure. You explain the risks and benefit. The nurses does not do that. The nurse can reinforce those information. As the nurse serves as a witness that what was told to the patient was enough for the patient to give a consent for the surgery. If you receive a narcotic, you cannot do that because you are impaired. If you receive any Valium or sedative, you are impaired. A competent patient, and then you can voluntarily, we cannot force you to surgery. These are concepts. I want you to write it down. You can use it to answer any questions on informed consent. Therefore, what do you think is the right answer? Getting medication before that is a bad thing. Know that. And the last question, think about it, is the one that I want you to think about it carefully. Which action by the nurse is most appropriate? A nurse is caring for a terminally ill client who states, I don't want any more treatment. I just want to be comfortable. He said, I'm done. The client family insists that everything needs to be done as much as possible. What would you do? Follow the family wishes to continue your treatment? Ask the provider to explain the treatment option again to the family. Honor the client's wishes and notify the healthcare provider. Refer the family to the hospital ethics to overrule the client. If you are in this situation, this was a question you saw, what would you do? There is no ethical dilemma here. Patient autonomy trumps everything. Therefore, number 4 is wrong. Follow the family wishes. That means you don't follow patient autonomy. Therefore, 1 is also wrong. The provider does not need to explain the treatment option again. That means you are not listening to the patient. You can see they are all saying the same thing. 1, 2, and 4. I'm using the word autonomy. This is how you answer question. Autonomy is the key. I use it to test it against 1, 2, and 4. They are saying the same. You are violating autonomy of the patient. Therefore, honor the client wishes and notify the healthcare provider. 10 questions. These are the most tested on ethics and legal. And in a very short time, you master this concept. You see what you've done. You have attained some knowledge on ethics and legality. Thank you for watching. If this video helped you, put the like button, subscribe to Adapt NCLEX, write a comment, and let me know how you're doing. If you need more content, put down in the comment what kind of content you want, and Adapt NCLEX get you back. Remember, never stop charging. Keep charging as always. All the best of luck, and take care of yourself. Bye.